Okay, yeah. You
Good
tell
to
me
go?
when to go.
You are welcome. The floor is yours.
Okay, thanks. I won't be sharing the screen, but I will post this talk for you to share. So if anybody misses parts of it, that's fine. I'm not a great fan of PowerPoint for various reasons, but anyway, so we're talking about patient advocates in Australia, and probably patient advocates a bit generally, because when Stacey set this topic, I was a little bit hesitant because this is a different country to America. In population, we're 25 million, you're 300 million. There's bound to be less things happening here. And when you're working in the space that I'm working in, which of course is male breast cancer, well, there ain't many, maybe 150 cases a year. And in the States, it's more like 2,600. So I'm going to start off by talking about Australia, and then I'll drift into, perhaps where I'm better known, and that's on social media. So in Australia, we engage a bit differently with the clinical and research community than you do in the US. From the patient's perspective, the advocacy differs because the links to pharmaceutical companies that are more distant here. Legally, these companies are unable to market directly to patients, and this rule impedes them from inviting patients to attend conferences where Big Pharma is a sponsor. So that's too bad. So you miss out on a lot more pens and things, and probably decent nibbles. But so it also means that you're unlikely to find a patient advocate on company advisory boards. And however, there's plenty of connections between cancer charities, cancer research institutions, and of course, like as we all do, with the patients themselves. So a breast cancer diagnosis for a male is very often a surprise, as it is for women, of course. And it's also cause for great consternation for all of us. So because, as I said, there's only 150 annual cases reported here, and the disease is rare, and because so few men seem to seek outside help, and apart from their families and their medical team, I don't get to help that many of them. I guess why so few men come out with this disease is a really good question, and I think many people here will probably have anecdotal evidence that men are pretty reluctant when it comes to facing up to medical issues. And then I think with male breast cancer, there's a stigma attached to having, what is perceived to be a female disease. And I think a lot of men, and I've worked out this from editing the stories of well over 100 men for the Male Breast Cancer Coalition. So I'm really in tune with what people are, what guys are saying about this. And so many of them left it a bit late, had to, got nagged by somebody to, go to the doctor. Oh yeah, I will. And I think that's a bit of a drawback for men, because the later diagnosis often leads to not as good prognosis. So anyway, that's the sort of background to it. But being a patient advocate, as we all know, is very satisfying. And I think our little secret is that we get so much out of it. We honestly get a lot out of helping other people. And I don't think anyone would hang around in this field if they didn't get something out of it. And while we've just heard about, the passing of Chantal, which is a dreadful thing, and I could mention two more people that have departed since San Antonio last year. And I just think all the time that's something we have to face, and we really have to be strong and go on doing what we're doing to try and solve, the problem of people getting poorer treatment, people going through the whole thing by themselves. There's a lot of ways that we really are for other people, and I think we should be celebrating that. So, and often we've benefited so much from having help from other people, and you know, we're all pretty busy paying it forward, I'd have to suggest. So I think the role of the patient advocate is amazingly important. And so anyway, I cut my teeth here as a regular poster on breastcancer.org, which we all know. I Googled it, male breast cancer, that came up the top, and that was a community there. Seemed to have a few men coming in. This was 6 years ago, and I have to say, since there's hardly any men there nowadays, but that's because breastcancer.org is not the big site that it was. But so it was great interacting there. I soon learned that, you know, women weren't very happy to see a guy if they were just diagnosed. The women just being diagnosed. So I stuck to my patch, which was inflammatory breast cancer, and yeah, helping guys, mostly young guys come in. Oh dear, I've got a lump under my nipple. I'm going to die next week, and all this sort of stuff. So 99% of them were easily satisfied that they didn't have breast cancer, that they had a scan and a biopsy if necessary, and so they were happy to move on. But there were men that came in late stage and really needed, you know, a lot of talking and talking to and listening to them. That's sort of really the clue to what we have to do a bit as well. 2 years later, I was diagnosed with prostate cancer, so I thought, oh, I better get myself across this disease, and I went on a few forums there. I was treated with a prostatectomy, so I've had a mastectomy, a prostatectomy. I feel like I've got a bit of knowledge across a couple of the most popular cancers for men and for women. So I'm in a bit of a unique spot. So fortunately here, because I was out there a bit, I attracted the attention of cancer charities, and they got me and trained me as a telephone counsellor. I went and volunteered at an infusion centre. So I sort of thought that grassroots contact with patients is really important, and it's very easy to, you know, to Skype and to Zoom, but it's harder when you're seeing people with tubes in them and infusion lines and the whole thing, and that was quite an amazing experience. So then I managed to land a spot on the 2018 project lead course in San Diego. That was a blast. I met a lot of fantastic people there, and I was really last year going to SABS in San Antonio, which I can see so many people here were there, Kelly and Sandy and Stacey, and if I've missed anybody, I'm sorry.
Barbara.
But okay, someone there.
Barbara.
Oh, Barbara, yes. And Patty, were you there, Patty?
Yeah, I was there. I didn't do a lot of socializing. I had too many meetings, but I was there.
Yeah, that's amazing.
If you went to the Hyatt bar at night, I was there.
Oh, the Hyatt bar. Well, I missed that, but that's amazing.
That's our hangout.
I'll have to remember that next time if it ever gets cranked up again.
Yeah.
But it's amazing how you go to that event and you think, oh, I'm going to spend a lot of time with everybody, and really you just get a glimpse of people. I would have loved to speak to, you know, I knew
I had
Sandy.
a lot of NCI meetings with just water. Yeah.
Yeah, no. But so SABS, and I was really blown away by the kindness of the people I met there. And this included the people from people who know about social media, Twitter hashtag BCSM, which is a weekly gathering of people. It's usually a different topic each week. So it's okay, as I said before, Zooming and Skyping, but just to get there and meet these fabulous people was a blast for me. And sort of that sustains you. Okay, you can do some Zooming after that. So you know people and you can go do a bit of Zooming. So one thing led to another. Now, I'm writing articles, doing videos and giving talks and editing those stories that I mentioned before. And I've got a niche, you know, a nice little niche. And I'm really amazed on Twitter to how many medical professionals follow me, and of course other people here, because it's those medical people that we really need to connect with, and there's so many wonderful people there. And you'd have to mention Tatiana Prowl and Elaine Shatner and any number of people that are just fantastic. And I get so much from that, like we all do, I'm sure. So I thought I'd just end this little chat by just summing up the sort of who we need to be, okay? I think we need to be able to listen as well as learn, as well as help people. And I think listening is one of the great skills for patient advocates, because, you know, we don't know everything. And often when somebody's trying to, I won't say unburden themselves, but get themselves into a zone, I think they want to talk, and we have to listen. So we have to also be open to the different ways to share our messages, and, you know, social media is great, talks and the whole thing. So I'm sure we're all doing that here. You know, you wouldn't see an event without Sandy there, so I don't need to tell
Yeah,
her.
we would.
No, I don't think so. Unless it's
Yeah.
unless it's at the bar at the Hyatt with Patty.
Yeah, there
By
you
the
go.
Marriott too.
Okay, that's good. Okay, that sounds like the place I need to be next time. And so we've got, you know, support from like-minded individuals, and I think we need to look at and respond constructively to different positions and issues. So we need to also be able to bounce back from negative responses. There's a lot of negativity out there. There's a lot of reasons why you could throw your hands up in the air and say, you know, bugger this. And most importantly, and I'd be interested to hear what other people think about this. Most importantly, I think we need to be resilient enough to handle all the trials and tribulations of our disease, along with that of what you might call a burden of helping other people. So we need to be strong to help other people, and we need to keep ourselves strong. So I think that's really pretty crucial. I think, you know, we all have other things going on, and this is like added on the top of what we do. There's burnout, there's all sorts of things, and I think if we can be resilient, that's a fantastic trait, and it really takes a lot of knocks to be resilient, as probably most people know. So anyway, that's it. Thanks for listening, and any questions are welcome.
Thank you, Rod.
Thank you.
I appreciate that. I have a question, and again, I'm kind of fascinated. I learned about this, actually I was with Kelly at the mask symposium a couple of years ago.
The mask symposium we had to advocate to get ourselves invited to,
yeah.
that one? Yeah.
The one that we, you know, kicked down the door and then
Yeah.
ended up on a panel. Yeah, that one.
Yeah.
But one of the things that, and for those of you who don't know, this is the Multinational Association of Supportive Care in Cancer. So every 3 years they meet on US soil, and then they alternate. So this year, this 2020 was supposed to be in Seville, Spain. And they have, rather than do that virtually, they have just shifted the whole meeting. So maybe it's going to happen in real life in Seville, Spain in June of 2021. But one of the challenges that mask has, and Rod, this is what I'm so fascinated by, if they want a big meeting, and if they want to continue to have sponsorship and generate funds and want to include patients, they can't take any pharma sponsorship. Like, not even like, you know, it's beyond the booth. Like, you can't even have, like, you know, when you go to Chicago for ASCO, you can't even have like the signage. And so working with them to try to figure out how are ways that we can get patients in without the standard US way of having, you know, the people with the money support that. And I'm just wondering, where do the dollars come from for advocacy? Obviously, I think, you know, there's probably a ways to go to get patients into the room in Australia with the clinicians as the research is being presented. But yet advocacy has some funding. And so is all of that private donation? Is all of that little tiny nonprofits just kind of coming together? What's working?
Okay, it's mostly charities sponsoring people to go to events, and I don't see a lot of private funding, but there's probably avenues that I haven't explored. I think you just got to remember that the scene here is so much smaller, and you've all got choices, all geographic choices around the States. It's a huge country. You've got many, you know, ASCO and all the different events that you can go up to and you're welcome at. I think as we mentioned before about the pharmaceutical funding isn't there for probably for legal reasons as much as anything. But I think it's a coming field here, and I'm learning a lot from all you people and how you operate. And I've probably got to be a bit more proactive and go out there and, you know, rattle a few cages.
So,
Yeah, that sounds.
So, Rod, are you working with the Australian Breast Cancer Association?
Yes, there's a Breast Cancer Network Australia, which
Yeah.
is the most widespread one. They have forum and they have a lot of activity, and they do, do Pinktober and all that sort of thing. And I had a great success with them trying to, because it's all pink, you know, it's a pink website. It's their logo is a pink woman, looks like a 50s sort of throwback. And a couple of years ago, my friend Rob, who's no longer with us, unfortunately, we made up manifesto, and one of the things was to they had the website. It was all woman this, woman that, and they changed it all to people get breast cancer, people do this, and you know, we were blown away. It was just like you just ask and it happens. But I think I think the pressure is there. I think I know a lot of the UK charities have changed things, and Komen even, gosh knows, maybe they're going to burst into the 21st century one day. But fighting the whole pink thing, the pinkness of everything has been another thing, because that's sort of blindsiding men and they're turning up late for diagnosis, as I said. But yeah.
I had a question is,
Hi, Lee.
hi. So for many years, I started the Lobular Breast Cancer Alliance, and I've since passed on that day to day, thankfully, to someone else. But I also have fallopian tube cancer, just as an aside. But one of the things that I am taking on with the lobular breast cancer community is international organizing. We have a group that started in Ireland. We have a group that's starting up and getting formal. They actually have their formal charity status in the UK. We have people in Australia who have been pinging us. Lots of people all over Canada and they haven't quite gotten themselves organized yet. And I know you, with male breast cancer and inflammatory breast cancer, you've had to figure out how to run and put together some effective communications and coalitions across borders. And I'm wondering if you have your Cliff's Notes tips, or if I can ping you later.
Look, I certainly
about that.
I would, I'm sure, have a lot of things I could help you with, Lee. Honestly, if you can pass Stacey my email address, we'll hook up and yeah, because I'm going through these different areas. You're a co-cancer comorbidity pal. We got to stick together.
We got to stick together.
I absolutely, connect offline and get specific. But this is the exact type of thing. The question that Lee asked and the information that you're going to be able to pass on, we really want to pass on to the whole group, right?
Yeah.
And again, we are a very heavy breast cancer audience today. So I keep looking at Grace and making sure that she's, you know, kind of still with us on this one. But that's the secret sauce. That's why we are a group, because Rod, you and Lee could have connected at SABCS and figured out the secret sauce. But if we can share that in a forum that's public, that other people can take into their own spaces, that's the magic. And if you have things to offer right now as we're recording, so people who weren't able to join us, that's really,
yeah, no, I'm happy to. No, Stacey, that's all good. So I mean, I would say things like persistence, never let anybody say no, try and work out who your allies are in the field, and there's often some people that you don't even know about, that medical people particularly, who are very open to suggestions. I think you know, we're all big on social media, but there's no reason why you can't meet people if they're in your district, why you can't hit somebody up for funding if you need to produce material. The way it seems to operate, and I see through this group, Sandy could probably help here as well, like relies on a lot of volunteer labor and a few people doing a lot of work. And it's, you know, this is such a complex disease. I mean, how many subtypes and variations, you know, IBC and lobular and then early stage and late stage. And it's like we're spreading ourselves very thinly. And there's people with I've got some genetic issues as well with the BRCA genes. And so there's a whole new area out there. And everybody's got a different combination of things happening to them and a different interest in them. So, yeah, I don't know, persistence and and people like Barbara, who work in a very small pool as well, I think would have something to add to this. You tell us, Barbara, what happens in Puerto Rico?
I wanted to ask you, because listening to you, I admire you, and thank you for sharing. And having breast cancer and then prostate cancer brings me to how men participate at Advocate. You know, we women like to talk a lot and we are very involved, and that's why maybe breast cancer has moved as far in terms of advocacy compared to others, because it was a group of women that sat, and even though men are we are the one anyways. But with men, and I go like for especially cultural differences, and for prostate is very prevalent in African American and in Hispanics. And for Hispanics, the macho guy and all those things is very, I think they come in resistance of getting involved or accepting they have the disease, and let alone sharing with other men. And I always worried because when we did the training here in Puerto Rico we wanted to open it to any cancer, and we ended up with 15 breast cancer survivors, because not even colon cancer, that is very active, very prevalent in Puerto Rico, people knew about advocacy. So I think we have a long way to go to get people understand how to be an advocate. And I don't have to have a university degree, or you know your disease, you know what is important for you. And what I would like to see is more men involved, not only in breast cancer, because there's a small, a percent that does have it, but in other cancers as well, because they are in lung and in prostate, they are number one, and they don't get involved. So maybe your perspective and from your area, how have you dealt with that, and were you able to convince other men to join you?
Yeah, well, I've got a list of 12 men who have both those two diseases that I have, and I come at it from the BRCA thing, which, as you know, with women can be breast and ovarian cancer. With men, it can be breast and prostate cancer, and sometimes colon cancer. I think the whole study of genetics is in its infancy, and we won't all know, perhaps for years, just why some of us got breast cancer. You know, I've had a family history, as some other people have, but then you got these people that just, that were athletes and dietitians, and turn up and say, well, how did I get it? You know, what's gone wrong? I don't have any family history. It's such a mysterious disease when it comes to causes. But I think it is interesting, Barbara, that you know, when you're mixing with people from other cancers and have other cancers rather, I think there's a lot of commonality there, and they can all go the same way. They can all go to stage 4. They, you know, some quicker than others, and I think that's what keeps people on their toes.
Can I say something?
Hi, Grace.
Hi. Thank you so much for this because, you know, Ben are usually the very last persons to own up to any problem, medical conditions or whatever. And especially as Barbara had said, African Americans, Hispanics, the whole macho thing. I'm originally African, and my brothers would be the last to own up to say they had. I still have friends who have hidden their prostate cancer diagnosis from their wives. You can imagine how long you have to. You're living in the same house with your spouse, and you're making up stories every day until eventually it comes out. I was fortunate to have been invited to the Cancer Council Australia to come give a talk virtually. And one of the guys there actually had breast cancer.
Okay,
And
there you go.
I was surprised he was very, you know, open about it, because like he said, a lot of people were very upset that he was opening up about it. So we still have that stigma thing, like you rightly said. So
Yeah,
it's really nice that you have come out with that too. This is something I press on about, you know, that men should be more open about everything, You don't have to hide it. I push that. So I don't know. I know this may not be, I don't know when I can catch you again. I would love to invite you to my show to talk about this so that my African brothers can listen to this, because, you know, I have a lot of Hispanic friends. I have a lot of, you know, my Black brothers on the continent. They'll be the last to say they have prostate cancer. And before you're diagnosed with prostate cancer, you must have had it for some years before it becomes full blown. So you know that something must have been going on for you to have hidden it for so long. So thank you for that. You know, it's really helped me know which way I'm going to go. God's this.
Yeah. Well, thanks, Grace. I definitely will come and talk wherever. You know, that's what I love about this, the connectivity today. We can all get together, whereas we couldn't find anybody before. It's all great.
Thank you.
And so that's kind of amazing that you have a group with, what you say, 12 men that have breast and prostate cancer.
Yeah, it's not a group. I just have their names and addresses, Stacey, and I say, okay, I'm waiting to find out why we have them. Just I'm not going to spam them. I'm not going to. Occasionally, I get asked for people doing articles, and I approach them. I say, hey, do you want your story told? They'll say yes or no or whatever. And but you're right. That's it's a great list.
That's a lot. Yeah, that's a lot.
So how did you manage your mental health during this time? Because it is, you know, I'm very huge on mental health as well. How did you manage having both diagnoses? Did you seek therapy or whatever?
No, I didn't seek therapy. I think, as I tried to allude in my talk, my therapy is unburdening myself on other people in the guise of helping them. No, which of course it is doing. But I think the more you keep it in, this is the whole point, Grace. This is what you tell the guys. The more you keep it in, the sicker you get. You're better to let it out there. Okay, it's a lot of shit there, but you must really, you know, just be very open, and it's. I think it clears your mind. I don't know if anybody else feels that way, but
yeah.
I facilitated a support group for the first 10 years after I was diagnosed, because it was kind of given to me, and it, you know, I'm still friends with, you know, quite a few of the women we meet monthly, or before COVID, we still met monthly, and this has been 20 years. So yeah, you form really key relationships when you kind of talk these things out, right? Quite a bit.
Yeah, that's great. That's great, Patty. That's amazing. 20 years and you're still dealing with people.
Yeah, we've lost quite a few, but we remember them in everything that we do. So
Yeah, that's
yeah,
good.
it's been, but it's rough. One day a girlfriend from the group said to me, we need to get new friends. This is not working,
That's right,
because we
new
lost
blood.
quite a few in a row. And, but I'm glad we were there for everyone. We were very a supportive group. So it was quite amazing. But I also, we'd go to this other place and they had, the difference between breast cancer patients that do support group and prostate cancer patients that do support groups. The prostate cancer patients always brought a wife with them or a
Okay.
female partner.
No, the wife
Whereas
probably
the
dragged
breast
the
cancer, they
prostate
come
cancer
by
patient.
themselves. Yeah, but then also I found a difference between rural and city. I was in
Yeah.
the city and our breast cancer group was just women and they came by themselves. But my mom is in a rural environment and she had a breast cancer support group. And I went and talked to their support group and it was so different. The women came, but their husbands also came, but the husbands met over on the other side of the room and watched TV or I don't know what they did. They were over there.
That's a
and
bit
the
funny.
women were
Why
over
did
here.
they bother coming? Why did they bother coming?
Because I don't know, it's a rural environment, so they could have driven a long way. I don't know,
Yeah,
right?
that's
A lot
true.
of
they're
a lot
more
of the women that go to my
Yeah.
original group are older. I mean,
Yeah, and they're
the
older.
breast cancer tends to,
Yeah.
the average age is 62, not 39.
Yeah,
And so a lot of the women who had been coming for a long time didn't feel safe driving by themselves at
Yeah.
night.
Yeah. No, that's fair enough. So
Yeah.
they were chauffeurs,
And they're
basically.
older. Yeah, when I walked into, like, my mom was diagnosed with breast cancer and bladder cancer as well. And so when I walk into her clinic, it's so different. It's all old people, all older people. But then they're so friendly, like, oh, hi. She couldn't even walk down to the labs because everybody was stopping her, right? So it's a very different environment. But then
Yeah.
when young people are diagnosed in that environment, we would have something in Raleigh, the big city. And I remember this young woman coming, young African-American woman, and she said she loved to come to these things in Raleigh that Komen did because she thought she was the only young woman and the only African-American diagnosed with breast cancer anywhere, because she would walk into the rural clinic and not see anyone that looked like her. No one looked like her. So she loved to come to the city and see other people that she could talk to that were like her. And so it's
Rod, I have a question completely unrelated to support groups or to kind of one we've been talking about, but I'm curious and I'm not quite sure when I'm going to get to ask it again. We do a lot of work here as advocates with the FDA, with clinical trials, with getting things approved, with what is the process like in Australia with the national health system? I know that we have drugs here that you don't get, or we don't have coverage for drugs, and as a national health system, that's something that maybe you guys don't worry about.
Yeah, no, that's a good question. There is a drug approval body here, and they're always assessing drugs, probably looking at the FDA research results and appraising them for what we have here is the public health system, which is a two-tier system, private health and public health. Those drugs, those fantastic drugs, I've got a friend with ovarian cancer who's just landed on the, I'm just trying to think of the drug, Pickway or something. She's stage 4 ovarian cancer. Now she's probably getting $150,000 worth of drugs for maybe $100, right? So it's easy. There is a limit to what the nation can afford, I guess, but a lot of those drugs get here and they are appraised and then they get put on the pharmaceutical benefits scheme. So in answer to your question, it's different, but there's some similarities.
Do you find that clinical trials are run in Australia and they kind of do their own drug approval process? Okay.
Plenty of clinical trials, but not many that they let the men in on, and that's another one of my little pet peeves. And through banging on about this for years, now you've got the FDA in the States saying, if possible, get men into your thing. I know there's not many of them, but keep the results in a drawer. this that might be useful, but don't exclude them unless there's a really good reason. And so I'm badgering away here to get that same thing. But again, it's a smaller research scene, but lots of money is raised, as you know, when the pink fund runs and all that sort of stuff. There's a huge amount of money, but not a lot of it goes to specific male research. I guess I'd be complaining about that, but I get it. The money goes where the people are, and I'm not overly concerned about that.
And is the trial design, again, we spend a lot of time here talking about trial design and how we could do better. And part of doing better is including patients and advocates at the beginning. And is any of that work being done in Australia? Do they?
Yes, there is some of that. Yes, Pat. Yes, Stacey, there is some, some of the public research institutes look for advice from patient advocates, but it's pretty nascent industry, if you like. So I don't sit by the phone waiting for someone to call me.
Fair.
I'm with Patty down at the Hyatt Bar.
Yeah, there we go.
Yeah, and again, anytime you want to be plugged into anything, I think we're all welcome to, or all willing to connect everybody to everybody. I would just be really interested. I think in some ways, being small as a country also allows a nimbleness, and I'm wondering, quite frankly, if there's less bureaucratic BS in this process than there is here.
Oh, that's a good question. I'm not sure how much bureaucratic BS there is in the States, but I think there's probably a fair share of it. Yeah, well, I perhaps haven't got a good answer to that. I'd probably say it's similar.
Okay.
Hey, Rod.
Yep. Hi, John.
Hi, nice to see you. I had a question and a comment. The first is the comment, and again, coming from what I do for work with Inspire, I can tell you that with the communities that we have, the dynamic of, again, males sharing and sharing information back and forth across quote unquote men's health issues versus women's is quite profound, and we see it every day. And one of the obvious examples is there are far more females who are wives, girlfriends, adult children, and are active in our prostate cancer support group than there are husbands, boyfriends, adults, or fathers even in, say, our ovarian or cervical cancer group. And the numbers are so stark there, and it is definitely a barrier. And I did put in the chat, just because I've become friends with them, as a relatively young 40-ish year old guy who started a group. He's, I think, 3 years into his cancer journey, his treatment, for which he's still receiving treatment. And as somebody who was in the land of the well, and then now in the land of the pretty seriously ill, he found it strange that no one wanted to talk to him about his colorectal cancer. His name is Trevor Maxwell. I put in it. And I just think he's a wonderful example of somebody maybe not being aware of prior, like, you don't talk about this thing below the waist, or a thing that emasculates you, or, for women or men, obviously stigmatizing diseases result in silence, and silence can result in, again, more, later diagnosis, poorer prognosis, etc. We see it all the way there. So celebrating people like you, like Trevor, and like others, everyone here, of course, can only lead to something better. My question is, in Australia, given the size and the size of the country, do you find yourself connecting with other patient advocates? I mean, I see you on Twitter. Obviously, there are across cancer disease, but again, you could be friends with somebody who's an osteoporosis advocate because they figured out a way to hack something, or you just hit it, and there's that wonderful cross-pollination among patient or caregiver advocates who are trying to help one another. Is there anything like that you're experiencing, or you're kind of in your lanes? Too many.
Thanks, John. That's a good question. I'd have to say within cancers, there's a lot of cross-pollination, cross-interaction, not pollination. But I think say going to talk about a patient advocate who's into, say, osteoporosis or anything you want to name, diabetes, I don't think there's any cross connection at all. I think, cancer's such a wide field, and I mean, and you tend to build up your knowledge levels, and you probably know this as well. And you're in a zone, and that's where you stay because there's enough work there without drifting. Hi, Lee.
Hi.
You're talking. I can see.
I was agreeing.
You just came on. You agreeing.
And like picking up on John's comment too. I think I'm involved so heavily in the women part of breast cancer, but even before I was a breast cancer advocate, I was an AIDS advocate, and
yes.
That was pretty heavily women as well.
Well, that's amazing. That's
but that's where I was when I was diagnosed. I was an AIDS advocate, so I switched over to breast. But I'm always interested in the dynamics and the different ways that male and females advocate, because I actually am the chair of a patient advocate committee of the Alliance, which is all different cancers. And when all the prostate cancer patient advocates couldn't go to a meeting, I actually attended the GU committee meeting, and I had gotten a lot of complaints from them about not being involved, or I don't know, they were complaining a lot. So I said, well, let me go see. So I told them I was there and I participated, and it was great. It was one of the best meetings I've attended. And at the end, they asked me to join it, even though I didn't have a prostate. And I'm like, no, you have 2 prostate cancer advocates. And I think they sit back and wait to be called on rather than put forward. I don't know. I just got kind of this feeling, and then years go by, and actually we lost quite a few of our prostate cancer advocates to metastatic prostate cancer. And I was looking for another advocate, and we got a kidney cancer advocate, Dina Battle, who's amazing, right? So she's just amazing. So I put her forward plus a prostate cancer advocate and said, you choose, right? To the chair of the committee, because it's his choice. And I said, these are equally qualified. You've never had a kidney cancer advocate on the GU committee. And I know you're doing more kidney, but you've always had a prostate cancer. And he chose the GU committee, the kidney cancer advocate. And his comment to me was, I was at a meeting with him, and I said, so how's Dina working out? And he goes, oh my gosh. And he goes, finally, we got a breast cancer phenotype advocate in our group.
Oh,
and it's amazing.
Oh, funny.
So I don't know if it's just the difference between male and female, or really that prostate is really hard to talk about for men, maybe.
So I respect what you said, Rod, about, and John, I really appreciate the question is, have you engaged with other patient advocates, not necessarily within the cancer space? And I understand that there is a lot of work to be done in the cancer space, but I also understand that there are people who are as knowledgeable and passionate about their own disease communities. And especially when we start to talk about things like stigma, especially when we start to talk about things like racial disparities, especially when we start to talk about things like access, rural versus urban, there is the same, yes, there are similar, not the same challenges. And I really, I'm kind of not having a crisis of faith, but a crisis of boiling the ocean or not. I really want to bring somebody into this group to talk about that, because, when I think of stigma in cancer, I think of anything below the belt. Well, and then I met people with lung cancer.
Yeah.
And it's a different stigma. And the first question that they're asked are, did you smoke?
Are you smokers? Yeah.
So I really do respect the fact that there's a shit ton of work to be done in our own lanes. But man, we're going to learn so much from each other just by having a conversation.
And just listening to Grace inviting Rod to her show, I already envision, because I like productions in my mind, having like a panel of men from different cultures, different.
That would be great.
That would be nice.
Yeah.
and I'm having chills. This will be like once in a lifetime, and
Yeah.
people are listening that it's not Rod from Australia, it's Rod from Australia, Pedro from Puerto Rico, fulano. If we get
Yeah.
a few and have a program like that, we can do we can host. I think we could host as the ACE
That
group.
would be amazing.
Mhm.
That would be amazing because I would love to
Yes.
hear that. I mean, that would
Yeah.
And that we could all try to think of in different places, and Grace might know someone. I can think of maybe someone.
Sure.
be.
And I met we did a training in the Cancer Coalition center that I was an advocate also. And there was and it was a training about cancer being a chronic disease, and there were 11 women and one guy, and he was a prostate cancer
Yeah.
survivor, but he was very active, and he's a great guy. I will have to check if he speaks English and enough to do this, but I think it'll be amazing, and I haven't seen something like this, and ACE will be the first one. So
I think
Yeah,
that would
that's
be
great.
wonderful.
Yep.
That would be awesome.
I think this helped me.
Hey, where's my glass?
I have mine. I'm almost done.
It's almost 9 o'clock in Puerto Rico.
Ain't fair.
Mine's almost done.
I
A
think
little
when
Chardonnay.
I was hiding it because
my.
Sandy and Patty are drinking water, so I'm like, I was setting up my camera, but I might have. So I gave a good idea. So
Oh
I-
my
Barbara,
goodness.
have
Sandy's like, you
something.
have no
Okay,
idea
now
what's
we
in my
know.
cup.
Now we know. Now we know.
I'll have one for during the day session in case that helped me.
I was gonna say, if you knew Barbara before, you already knew.
She came to the
Oh.
Hyatt.
Exactly. I think that's a wonderful idea. I'm happy to help support a special session like that, so we
Mhm.
can make the time flexible, today
Yes,
flexible.
we do
So-
We have
that.
two men
Yeah.
here already,
That
so
would be nice.
we have Rod and John, so they're already recruited.
It's even like the
Yeah.
all cancer advocacy groups
Yeah.
through the Alliance, as well as at Lineberger. I have an all cancer group, but they're all Lineberger connected. And I only have 2 men. I finally got a second man again, but it's really hard to get men involved.
Hard to
and
find a good man.
You got
finally got a
shortage.
man.
Difficult.
So I shamelessly did this. I got the opportunity to give 5 minutes to the board of visitors at Lineberger. And I said, look, we have a prostate cancer position open. Anybody interested, email us. And I got some.
So I want to respect everybody's time. It is the
Yeah.
top of the hour. And I
Oh,
know
we're
that
getting
Rod's
carried
just starting
away.
his Friday, and East Coast is probably going for that second glass of wine.
That's where
Chinese
Kelly
food.
is.
In my defense, it's 1 hour ahead of Eastern time here, so it's already
Oh,
9 o'clock.
okay.
Wow. Oh,
Oh,
wow.
because you don't do the silly fallback thing.
It's
Oh.
it's 5 o'clock in the Pacific time zone now, so it's okay to have a drink,
I was going to say I was waiting.
even
I
for us
looked
West,
at
even for us. Westerners.
I was waiting for that, Kelly. Kelly, I was
I've been
waiting
on
for that.
calls since I've been on
Yeah.
calls all day today. It's been
Actually,
horrible.
Saturday, most of us day drank anyway, celebrating.
Really?
Sandy, the truth comes out.
Yep.
That, maybe a few minutes late, I'll stop the recording.
Well, you know.